Question 1. A mother who has been exclusively breastfeeding her baby for 6 months asks the nurse about additional nutrition for the infant. What information should the nurse provide? C. Gradually add cereal and cured meat. The American Academy of Pediatrics recommends and NBSB, breastfeeding and NBSB, or formula as the sole source of nutrition for about 6 months. And NBSB. After that, it may be time to add more nutrients, protein, iron, and zinc. These are found in iron-fortified cereal and cured meats. Single-ingredient foods without salt or sugar should be introduced one at a time, 3 to 5 days apart, to assess if the baby has an adverse reaction, such as diarrhea, vomiting, or rash. Breastfeeding or formula should be continued until the baby is 1 year old. Fruits, puddings, and desserts are not appropriate for infants. Finger foods do not supply necessary nutrients. Question 2. At what age can the pediatric nurse accurately measure a radial pulse in a child? A. 2 years. Under the age of 2, an apical pulse is most accurate and easy to locate. A radial pulse can be difficult to palpate and count in an infant and young child. Typically, apical pulse rate is taken for a full minute to ensure accuracy. This is particularly important in infants and children due to the possible presence of sinus arrhythmia. Question 3. The mother of a hospitalized 3-year-old tells the nurse that she must leave for a short while to pick up the child's sibling from school. The child asks the nurse when the mother will return. What is the nurse's best response? A. You will see your mom after you watch your favorite show. Preschoolers, ages 3 to 4, do not have a clear concept of time. They develop the concept by meaningful experiences, such as birthdays, and with their own schedule, such as meals or bedtime. They feel secure when they can understand and follow a schedule. They do well with before and after explanations. Question 4. The nurse is instructing parents on how to care for their 3-year-old child with a new diagnosis of Wilms tumor. One of the parents asks why they shouldn't press on the child's abdomen or be careful when bathing the child. What is the nurse's best response? C. It's important to keep the tumor intact. Wilms tumor, also called nephroblastoma, is the most common form of kidney cancer in children. The tumor expands the renal parenchyma, and the capsule of the kidney becomes stretched over the surface of the tumor. Parents and caregivers should be instructed to never and NBSB, palpate and NBSB, the abdomen of a child with and NBSB, Wilms and NBSB, tumor, as this increases the risk of rupturing the encapsulated and NBSB, tumor, which could cause cancer cells to spread to other areas of the body. Wilms tumor is usually not painful. If there is pain, it is from the rapid growth of the tumor. High blood pressure is triggered when the tumor blocks the blood supply to the kidney. Constipation is a possible complication, not diarrhea. Question 5. The nurse is at home with their 10-year-old son when the child falls off his bike and his front tooth is avulsed, knocked out. The nurse is able to quickly retrieve the tooth. What is the nurse's best action before going to the emergency department? A. Place the tooth in milk for transport to the ED. An avulsed tooth is totally dislodged from its socket. It is medical dental emergency that requires prompt treatment to minimize hypoxia and necrosis of the pulp of the tooth. Reinsertion should be done within a few hours. Do not touch or handle the root of the tooth. Rinse the tooth with saline and pack the socket with sterile gauze. The preferred storage solution is milk, with saline or saliva if milk is not available. Holding the tooth in the cheek helps keep it moist, but there is a risk of the child swallowing it, so this is not an ideal solution. Question 6. Which of the following pediatric clients is at the greatest risk to develop pediatric acute respiratory distress syndrome, PARDS? A. A child with a drowning experience. Pediatric acute respiratory distress syndrome, PARDS, occurs when fluid fills the lungs due to an infection or injury. Acute respiratory distress syndrome, ARDS, is a major complication caused by aspiration of water upon and NBSB, drowning, in which permeabilities of the and NBSB, lung and NBSB, alveolar and capillary walls increase, resulting in exudates in the alveoli that cause hypoxia unresponsive to oxygen therapy due to and NBSB, lung and NBSB, injury. While pneumonia can lead to ARDS, a temperature of 103.4 F does not provide enough information to determine if pneumonia is present. Congenital heart defects must be monitored, but this is not the condition most likely to cause ARDS. A leg fracture is a risk for pulmonary embolism, rarely associated with ARDS. Question 7. The nurse is reviewing laboratory results for a child with tetralogy of Fallot. Which value can the nurse expect to be elevated? C. Hemoglobin and hematocrit. Typical lab findings for tetralogy of Fallot include diminished oxygen saturation, hematocrit between 65% to 70%, normal is about 37 to 47%, and low platelet count and coagulation factors. Low O2 levels stimulate erythropoietin production by the kidneys and lead to a secondary polycythemia. Secondary polycythemia is characterized by higher than expected hemoglobin and hematocrit levels. The WBC count, BUN, and creatinine aren't directly related to this condition. Question 8. A pregnant client tells the nurse that her 5-year-old son asked, "How did the baby get in your tummy?" The mother asks the nurse how to answer the child's question. What is the nurse's most appropriate response? B. When your child asks, give a simple and honest answer. Sex education should be honest and age-appropriate. An appropriate response for a 5-year-old might be, a mother and a father make a baby by holding each other in a special way. The parents can also correct misinformation and tell the child that the baby is growing in a special place called the uterus. Question 9. The pediatric nurse is assessing a 5-year-old child for lead poisoning. Which finding will indicate the need for further follow-up? B. Visual motor problems. Lead poisoning occurs when lead builds up in the body, often over months or years. Even small amounts of lead can cause serious health problems. Children younger than 6 years of age are especially vulnerable to lead poisoning, which can severely affect mental and physical development. Neurocognitive indications include developmental delays, lowered intelligence quotient, IQ, reading skill deficits, visual spatial problems, visual motor problems, learning disabilities, and lower academic success. Signs and symptoms of lead poisoning in children also include hearing loss, irritability, loss of appetite, sluggishness and fatigue, abdominal pain, vomiting, constipation, and seizures. The other 3 answer choices are not associated with lead poisoning. Question 10. The nurse is admitting a child scheduled for a hernia repair. When obtaining the child's medical history, the nurse lists the following allergies. Which of these is most important for the nurse to document in the medical record and flag in the system? B. Balloons. Although all allergies should be documented and shared, the child's allergy to balloons indicates a latex allergy. Latex is used throughout a hospital: gloves, catheters, bandages, tape, electrode pads, and stethoscope tubing. Besides noting the egg allergy in the medical record, the child should also avoid foods that are linked with latex allergy: peaches, nectarines, apples, kiwi, figs, celery, carrots, tomatoes, papayas, and potatoes. Question 11. After their 6-month-old son is diagnosed with hemophilia A, the parents decide to go for genetic testing and counseling. The test results show that the mother is a carrier and the father is unaffected. What is the likelihood of their having another child affected with this genetic disorder? B. 25% chance that a female child will be a carrier of hemophilia A. Hemophilia A, also called Factor VIII, FVIII, deficiency or classic hemophilia, is a genetic disorder caused by missing or defective Factor VIII, a clotting protein. Hemophilia is inherited in an X-linked recessive manner. A daughter who inherits an X chromosome that contains the gene for hemophilia is called a carrier. She can pass the gene on to her children. Hemophilia can occur in daughters but only rarely. For a female carrier, there are 4 possible outcomes for each pregnancy. 1. A girl who is not a carrier. 2. A girl who is a carrier. 3. A boy without hemophilia A. 4. A boy with hemophilia A. Question 12. EMS transports a young client who sustained a gunshot wound to the head in a drive-by shooting. On arrival to the emergency department, which assessment should the nurse do first? B. Airway. Assessment of a head injury can follow the A to E algorithm. A equals airway, B equals breathing, C equals circulation, D equals disability neuro, using the Glasgow Coma Scale, E equals exposure, lacerations, facial fractures, depressed skull fractures, basal skull fractures, Battle's sign, clear discharge from nose or ear, or obvious penetrating injury. With any head injury, always consider the cervical spine. It may require immobilization before starting the assessment. Question 13. A newborn is diagnosed with tracheoesophageal fistula, TEF, shortly after birth. Which finding will be most important for the nurse to report to the healthcare provider, HCP? A. Cyanosis when feeding. The nurse should report any cyanotic episode to the HCP. A priority for TEF is to maintain an open airway and prevent aspiration. TEF is an abnormal connection between and NBSB, the esophagus and the trachea. As a result, swallowed liquids or food can be aspirated into the infant's lungs. Direct feeding into the stomach can also lead to reflux and aspiration of stomach acid and food. The other options are normal findings for a neonate. The normal respiratory rate range for a newborn is 40 to 60 breaths per minute. Tachycardia when crying is normal, at the top of the range of 107 to 181 bpm. Initial meconium is black, tarry, and sticky. Question 14. The high school nurse is teaching a sophomore health class about sexually transmitted infections, STIs. Which of the following is the most common STI in the United States? C. Human papillomavirus. Human papillomavirus, HPV, may not show any symptoms until it causes genital warts, a bump or group of bumps in the genital area. About 80% of sexually active people will contract this STI at some point in their life. Cancers from HPV may not be evident until they are discovered through routine screening. Chlamydia is the most common reportable, or notifiable, STI in the United States. Both men and women can get chlamydia. While the disease is easily cured, it can severely and permanently damage a woman's reproductive system, making it difficult or impossible for her to become pregnant. Chlamydia infections often have no noticeable symptoms, so persons infected with chlamydia may be unaware that they are spreading the disease to others. Anyone who has unprotected sex can contract chlamydia, although statistics show that sexually active young people, particularly women, are at higher risk. Gonorrhea is the second most reportable STI, followed by syphilis. Question 15. The school nurse has been invited to participate in a workshop for parents on childhood nutrition. The nurse knows that the primary nutritional disorder for school-age children is C. Childhood obesity. School-age children, ages 6 to 12, have a consistent but slow rate of growth and usually eat 4 to 5 times a day, including snacks. The Centers for Disease Control, CDC, reports an 18.4% obesity rate for this age group. Factors that contribute to childhood obesity are often lifestyle-related, too many calories and too little physical activity. Other factors include family history and habits, psychological reasons, such as stress, boredom, and emotions, socioeconomic issues, such as limited resources or access to fresh foods, and lack of knowledge about nutrition. Obesity in childhood can lead to adult health problems, diabetes, high blood pressure, and high cholesterol. Many obese children become obese adults, especially if one or both parents are obese. Childhood obesity can also lead to poor self-esteem and depression. Eating disorders, anorexia and bulimia, tend to occur in adolescence. Picky eating often begins in earlier than school age. Question 16. The Pediatric RN prescribes amoxicillin suspension 200 mg POQ 8 hours for a 3-year-old client with acute otitis media. The child weighs 38 pounds, 17.2 kilograms. The recommended daily dose range for children up to 40 kilograms is 20 to 40 mg/kg day in divided doses every 8 hours. Following the 10 rights of medication administration, what is the nurse's best action? A. Administer the medication as prescribed. The nurse should administer the dose, since it is within appropriate guidelines. The child may safely receive 344 to 688 mg day, in divided doses of 115 to 230 mg each. Amoxicillin, 20-40 kg day, is the antibiotic of choice for treating acute otitis media in clients older than 2 years who are not allergic to penicillin. Approximately 80% of children will have at least one episode of acute otitis media. The 10 rights of medication administration that are applicable here: right patient, right medication, right dose, right route, right time, and right assessment. Question 17. After a high school athlete sustains a fractured femur during a competition, a full leg plaster cast is applied. When the nurse provides discharge instructions to the athlete and their parents 6 hours later, which statement by the athlete indicates a need for further education? B. I should walk around on my cast as soon as I get home. Plaster casts are made up of a bandage and a hard covering, usually plaster of Paris. Client instructions include: 1. Keep the limb raised on a soft surface, such as a pillow, for as long as possible in the first few days. This will help any swelling to go down. 2. Keep the cast dry. If the plaster gets wet, it weakens and is unable to support the bone. 3. Do not put anything into the cast to relieve itching. This can damage the skin and cause an infection. A hairdryer set on cool or an ice pack over the itchy area can help. 4. Immediately report any pain, tingling, or numbness, or if the toes turn blue or white. Question 18. First-time parents bring their 2-week-old infant to the pediatric clinic because they're worried about their baby. Which of their concerns is the nurse's priority? D. The baby's spit-up seems large and forceful. Pyloric stenosis is a birth defect characterized by forceful, projectile vomiting. It occurs when the pylorus muscles thicken and become abnormally large, blocking food from reaching the small intestine. Pyloric stenosis is 4 times more common in boys than girls. Besides projectile vomiting, other indications of pyloric stenosis are weight loss, dehydration, being very hungry despite vomiting, lack of energy, and fewer bowel movements or frequent stools that contain mucus. The treatment for pyloric stenosis is surgery, pyloromyotomy. The other answer options are not uncommon for a 2-week-old infant. Question 19. When an outbreak of fifth disease occurs at an elementary school, the principal asks the school nurse to give a presentation to teachers and staff on how to prevent spreading the disease. Which of the following should the nurse include in the presentation? D. Teach and enforce proper hand hygiene. Fifth disease and NBSB is caused by a virus called parvovirus B19. The virus is spread by droplets in the air of saliva, sputum, or nasal mucus when an infected person coughs or sneezes. Most and NBSB, children with and NBSB, fifth disease and NBSB, catch it at school or daycare. Fifth disease, also called erythema infectiosum, got its name because it was fifth in a list of historical classifications of common skin rash illnesses in children. Incubation lasts about 7 to 10 days, up to 14 days. The spread of the virus can be prevented by following good hand hygiene and teaching children to cough or sneeze into tissues or their elbow, then washing hands. Food, school supplies, and common objects should not be shared. The child develops the characteristic slapped cheek rash. When the rash appears, the child is no longer contagious. Children should play outdoors as much as possible. It's easier for the virus to spread indoors, where people are likely to be in closer contact. Preventing the spread of the virus is difficult because people are contagious before the rash appears. The symptoms are like a mild cold, runny nose, headache, and low fever. Koplik spots are characteristic of measles. Question 20. The pediatric nurse is performing a respiratory assessment a 2-week-old infant. Which finding should the nurse immediately report? D. Nasal flaring. Nasal flaring and NBSB is a compensatory symptom that increases upper airway diameter and reduces resistance and work of breathing. It is a sign of respiratory distress. Other signs are retractions, use of accessory muscles in the neck, rib cage, sternum or abdomen, expiratory grunting, and wheezing. Normal respiratory rate for an infant is 40 to 60 breaths per minute. Newborns often have irregular breathing patterns that concern new parents. They can breathe fast, take long pauses between breaths, and make unusual noises. Question 21. Which eating disorder puts a client at the greatest risk of fluctuating serum electrolyte levels? D. Bulimia nervosa. Electrolyte imbalances are typically common in those with bulimia. Up to 49% of individuals with severe symptoms of bulimia have imbalances such as sodium and potassium. Vomiting, laxatives, and diuretics can cause electrolyte imbalances in the body, most commonly in the form of low potassium levels. Low potassium levels can trigger a wide range of symptoms, from lethargy and cloudy thinking to irregular heartbeat and death. Chronically low levels of potassium can also result in kidney failure and NBSB. Hypocalcemia can result from long-term use of diuretics. Magnesium and bicarbonate levels are also affected by hydration. Pica disorder involves eating things that are not considered food. Rumination disorder is a condition in which a person regurgitates food that they have previously chewed and swallowed, chews it again, and then either swallows it again or spits it out. Question 22. The maternity nurse is giving discharge instructions to the parents of a 2-day-old infant. As part of the discharge instructions, the nurse explains how to prevent sudden infant death syndrome, SIDS. Which action by the parents is most important? D. Place the baby on its back for sleep. Sudden infant death syndrome, SIDS, is the sudden and unexplained death of a baby younger than 1 year of age. Research suggests that the incidence of SIDS is reduced when newborns sleep on their back, supine position. The reason is that an infant may become hypoxic when asleep because of positional narrowing of the airway. Researchers believe that there are also problems in the ability of the baby to arouse from sleep or to respond to a low level of oxygen or a buildup of carbon dioxide in the blood. When babies sleep face down, they may rebreathe exhaled carbon dioxide. Normally, rising carbon dioxide levels activate nerve cells in the brainstem, which stimulate the brain's respiratory and arousal centers. The baby then wakes up, turns its head, and breathes faster to get more oxygen. SIDS babies, however, may fail to rouse. Evidence shows that the Back to Sleep campaign to encourage parents to put their babies to sleep on their backs has dramatically reduced the incidence of SIDS. Other known risks for SIDS are smoking during pregnancy and exposure to secondhand smoke. No one should smoke in the home of a baby younger than 1 year of age. There is no association between immunizations and SIDS. Question 23. During a routine checkup, the pediatric nurse observes that a 5-year-old boy is stuttering when he tells the nurse about his recent holiday. What is the nurse's most appropriate action? D. Obtain a referral for a speech pathologist. The child should be referred to a speech and language pathologist, SLP. The role of an SLP is to assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. Developmental stuttering occurs between 2 and 5 years. It may happen when a child's speech and language development lags behind what they need or want to say. The exact cause is unknown, although it is common in some families. It is different from neurogenic stuttering, which occurs after a stroke or brain injury. Psychogenic stuttering is rare, happening after emotional trauma. Child abuse is not a factor in developmental stuttering. Although the child's hearing should be evaluated, it is not the first action. Question 24. A 6-year-old child is admitted to the pediatric unit with suspected pertussis. What is the nurse's first intervention? D. Initiate droplet precautions. Pertussis, whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Symptoms include uncontrollable, violent coughing, which often makes it hard to breathe. After a coughing fit, someone with pertussis often needs to take deep breaths, which result in a whooping sound. Droplet precautions must be taken to prevent contact with mucus and other secretions from the nose and sinuses, throat, airways, and lungs. Illnesses that require droplet precautions include pertussis, mumps, influenza, flu, and other contagious respiratory illnesses, such as those caused by coronavirus infections. Anyone who enters the room of a patient with a contagious respiratory illness should wear a surgical mask. Question 25. When parents bring their healthy 2-week-old baby to the pediatric clinic for a routine exam, the nurse reviews the infant's record and finds that the initial phenylketonuria, PKU, test was performed when the baby was 12 hours old. What is the nurse's best action? D. Obtain a repeat blood test at this time. Phenylketonuria, PKU, screening is required by all 50 states. For the test result to be accurate, the infant must ingest some protein from breast milk or formula, which may not be possible before 24 hours. If the initial blood sample was taken before the infant was 24 hours old, it must be repeated by the 3rd week of life. A heel stick is usually done 24 to 72 hours after birth. If a baby is born outside a medical setting or if the baby is discharged prior to 24 hours, the nurse should instruct the parents to make an appointment for the test as soon as possible. Some states require a routine second PKU test 1 to 2 weeks after birth.